Visiting the dentist can feel overwhelming, especially when you hear unfamiliar terms. This guide explains common dental terminology in simple language to help patients understand their dental care. Common dental terms. 1. Plaque. What it means? A sticky film of bacteria on your teeth. Explanation: if not cleaned, plaque can lead to tooth decay and gum disease. Brushing and flossing remove it. 2. Tartar. Calculus. What it means? Hardened plaque that builds up on your teeth. Explanation: it can't be removed by brushing alone. Your dentist or hygienist will need to clean it off. 3. Cavity. Tooth decay. What it means? A hole in your tooth caused by bacteria. Explanation: it happens when plaque acids eat away at the enamel. If untreated, it can get deeper and more painful. 4. Filling. What it means? A material used to repair a cavity. Explanation: the decayed part of the tooth is removed and the hole is filled with a material like composite or amalgam to restore the tooth. 5. X-ray. What it means? A picture of your teeth and jaw taken with low radiation. Explanation: dentists use it to check for cavities, bone issues, and hidden problems. 6. Cleaning. Prophylaxis. What it means? A professional cleaning by a dental hygienist. Explanation: removes tartar, stains, and plaque to keep your mouth healthy and fresh. 7. Fluoride. What it means? A mineral that strengthens tooth enamel. Explanation: it's often applied during cleanings to help prevent decay. 8. Enamel. What it means? The hard outer layer of your teeth. Explanation: it protects the inner parts of your tooth and can wear down if not cared for. 9. Local anesthesia. What it means? Numbing medication used in a small area. Explanation: you stay awake, but the area being treated won't feel pain. 10. Bruxism. What it means? Grinding or clenching your teeth, often during sleep. Explanation: it can wear down teeth and cause jaw pain. A night guard can help. 11. Crown. What it means? A cap that covers a damaged or weak tooth. Explanation: it restores the tooth's shape, strength, and appearance. 12. Root canal. What it means? A treatment to save a badly infected tooth. Explanation: the pulp, soft tissue inside the tooth, is removed and the space is cleaned and sealed. 13. Pulp. What it means? The soft tissue inside your tooth. Explanation: it contains nerves and blood vessels. If it gets infected, it causes toothaches and may require a root canal. 14. Sealants. What it means? Protective coatings applied to teeth. Explanation: used mainly on back teeth to prevent cavities by sealing deep grooves. 15. Periodontist or periodontal. What it means? A specialist or treatment related to your gums and bone. Explanation: if your gums are unhealthy, you may need to see a periodontist. 16. Nerve. What it means? The part of the tooth that feels pain. Explanation: if damaged or infected, it causes toothaches, often requiring a root canal. 17. Gingivitis. What it means? Early stage gum disease. Explanation: causes red, swollen gums that bleed easily. It's reversible with good oral care. 18. Periodontitis. What it means? Serious gum disease. Explanation: it damages gums and bone. Needs deep cleaning or surgery if advanced. 19. Recall visit. What it means? A regular dental checkup. Usually every 6 months for cleaning, x-rays, and early problem detection. 20. Extraction. What it means? Removing a tooth. Explanation: Done if a tooth is too damaged or causing problems like crowding or infection. 21. Dentin. What it means? The layer beneath the enamel. Explanation: it's softer than enamel and can be sensitive if exposed due to worn enamel or cavities. 22. Scaling and root planing. What it means? A deep cleaning procedure. Explanation: removes plaque and tartar from below the gum line and smooths tooth roots to help gums heal. 23. Dental bridge. What it means? A device to replace missing teeth. Explanation: it's anchored to neighboring teeth or implants to fill the gap. 24. Dental implant. What it means? A metal post placed in the jawbone. Explanation: acts as a tooth root with a crown attached to replace a missing tooth. 25. Orthodontics. What it means? Treatment to straighten teeth and correct bite issues. Explanation: often involves braces or aligners like Invisalign. 26. Wisdom teeth. What it means? The third set of molars appearing in late teens or early 20s. Explanation: they may need removal if they cause crowding or pain. Why understanding these terms matters. Knowing these terms can help you feel more confident during dental visits. You'll better understand what your dentist is discussing and why certain treatments are recommended. If you hear a term you don't know, don't hesitate to ask your dentist for a simple explanation.